The Health Minister has revealed that a report into the Northern Health Trust says it's in a poor position and requires extensive support to improve. Edwin Poots told the Assembly in a statement that the review team he brought in last year has made 5 recommendations to improve the organisation.
I have now received the report from the turnaround team detailing the findings of Phase 1 of the review. The report addresses the terms of references comprehensively, and I am very grateful to Sue Page and her team for the significant work in taking this forward. Given the need to reduce waiting times in relation to unscheduled care, the review examined performance including quality and safety of services, outcomes and patient experience at the Trust's emergency departments, and has identified specific areas and aspects of the work of the Trust and its relationship with other providers of health and social care where improvement is required. The report provides the team's assessment of leadership capacity at the Trust and the changes necessary to improve performance. The report makes 5 distinct recommendations. They are to enhance the leadership capacity at the Trust and empower clinicians to lead change, ensure support to deliver an improvement plan in 3 phases, gain assurances that governance and quality systems are robust, gain assurance that mortality data is robust, and put in place a performance framework that will ensure delivery of the improvement plan and contains clear consequences for non-delivery alongside incentives for delivery. The analysis has identified that the Northern Health and Social Care Trust is in a poor position and requires intensive support to improve. It is reassuring to note that the team concluded that the Trust can be turned around. That is essential to improve the patient trust and experience at the Trust. However, support needs to be provided to enable it to do so. In relation to the Causeway Hospital, the report signals the need to remove any sense of uncertainty in regard to its future management arrangements. So I am very keen to remove that uncertainty. I told the House on the 19th of March that TYC consultation had indicated significant support for the action as set out in the Vision to Action document, and I confirmed that I was asking officials to begin work to take forward an options appraisal which would consider the future management arrangements for the Causeway Hospital, whether it should remain within the Northern Trust or transfer in the near future to the Western Trust. Preparatory work on the options appraisal has begun.
Also in the recommendations, the issue of mortality data has come up. Are you indicating that there has been doubts around how this data was collated, and if so, what impact that had, and what does it mean for the future?
In terms of mortality, there are multiple ways of calculating mortality, and the method that the Northern Trust uses doesn't give any particular concern. However, just to be absolutely certain, the report suggests running another methodology, such as that of the Dr. Foster organisation, to provide maximum assurance. So we're not saying that there's any risk there, but we want to double up there to ensure that we have that.
Could the Minister tell us what are the monitoring and evaluation techniques to be used to ensure delivery of the recommendations and the time frame for achieving the same?
Well, certainly on some of the recommendations, I would want the time frame to be almost immediate. I'd want to see improvement at a very early point, and that is certainly something that we are looking at. The longer term is that we would be looking for the Phase 1 improvement to be actually completed within 6 months. My view is that the public have to get better. They deserve better, and we have to do better, and we will do better. And that is why we're continuing to make differences here and challenge and change, and we will get there with the Northern Trust.
The Health Minister Edwin Poots.